do 2 rapid fire pharmacology practice questions. A patient is taking hydrochlorothiazide and complains of excessive thirst and frequent urination. What is the nurse's next best action? Pause the video if you need more time. If you chose D, check a blood glucose, you'd be correct. So frequent urination and excessive thirst are signs of hyperglycemia. Hydrochlorothiazide is a diuretic, and a side effect of this medication is increasing blood sugar. So most of the time patients can handle this slight increase, but our diabetic patients we want to be very careful with. So if our patient is complaining of this, we want to make sure that we're checking a blood sugar and following up on these symptoms. This medication is given for hypertension, so A would not be correct. We also do want to tell our patients to limit fluid because we are giving medication to get rid of fluid, so loading on a bunch of fluid isn't going to be necessarily helpful. And with the symptoms that the patient is showing, not really our first thing to follow up on. And there is an interaction between sulfonamides and hydrochlorothiazide. However, again, because of the symptoms the patient is showing, it's not going to be our first follow-up. A provider just prescribed verapamil to a patient. Which of the following diagnoses or conditions would cause the nurse to follow up and clarify the order? Pause the video if you need more time. If you said C, second-degree heart block, you'd be correct. So verapamil is a calcium channel blocker, and this is one of the calcium channel blockers that not only lowers blood pressure, but lowers heart rate. With a second-degree heart block, our patient is already going to have a much lower heart rate, so we do not want to give a medication that's going to lower it even further. If you saw a patient who had a second-degree heart block and they also got verapamil as an order, you definitely want to follow up with your provider on why they prescribed this and if that's actually what they want to do. Hypertension, that's an indication of this medication. Again, it's going to lower blood pressure. Headache is an unfortunate side effect of this medication for some patients. And the last one, ulcerative colitis. This is something to follow up on as well. This is a GI disorder, and calcium channel blockers do work in the GI tract. Again, they're blocking calcium. You can see some constipation, so it's a good conversation to have, but not our first follow-up. If this was helpful, go ahead and save this video and follow along. Also check out my Stan store where I have a subscription for 2 practice questions a day.